and stuff like that. It's as I said, the norm, but things are changing, and we're moving into the digital era and into treatment with removable appliances, mainly aligners. And 3D printing, which is our main subject here, surprisingly, still is not part of the educational curriculum in all universities. So pretty much I've been learning from other colleagues, reading stuff, actually joining different groups on the internet. And it has been a very exciting journey, going into the digital dentistry and using software to be able to move teeth actually on screen, and then having to apply that in our clinical world. So CAD/CAM, the design and the manufacturing process using computers has been integrated into my office. I would say more than a decade ago. 3D printing is our most recent tool that we have been using. Otherwise, we wouldn't be able to be producing and manufacturing aligners in office. So as we will discuss later on, there is a big opportunity for kind of smaller practices to be able to be the point of design and manufacturing, and again, for the benefit of the patients, remotely monitoring them. So I have patients abroad, I have patients in different cities, and if it wasn't for digital dentistry and 3D printing, I wouldn't have been able to do that. I'm leaving last social repercussions, because as Jenny said, we have been through the pandemic, but Greece has been through, unfortunately, an economic crisis for more than 10 years. So it was the fiscal crisis, then the pandemic came, and then the Ukrainian war came. So we're under stress for, let's say, I would say since 2011. And I'm dealing with a population of people that are striving. There is unpredictability of the future, but still I have an obligation as a scientist and a doctor in the medical field to provide the best treatment possible, but also to make it affordable. So digital orthodontics has helped me a lot doing that. Just a few words about how we can use aligners and what the advantages are for people that are not familiar with that modality. So we have individualized treatment plans, as I'll briefly share. So for every patient, different aligners, a series of aligners is being manufactured to move teeth from one stage to the other. It's not like braces that they have to come every month. It's very aesthetic, so it's very good practice for adults or for teenagers that are kind of more self-conscious. It can fit into the kind of hectic lifestyle easier. We have no emergencies, which is very good for the practice and also for the patients. And I can communicate my treatment plan with other doctors because it's digital. But a disruption happened in the orthodontic field with big manufacturers joining in, and a mass production of aligners, and also DIYs, do-it-yourself orthodontics, meaning that people, especially in the US mainly, could go, let's say, to maybe the mall and have their teeth scanned and have their aligners mailed at home without actually being clinically seen by a specialist, a health specialist, an orthodontist, which to me is very, very surprising. And it's also another factor to consider if you want to keep up with, let's say, a small practice, not having to be forced to join, let's say, big practices to be competitive. And so that's why we have a lot of literature going on in the orthodontic field talking about 3D printing. And actually, this is one of the latest issues of the Seminar in Orthodontics. It's one of the most renowned journals. And I was honored to be invited to write an article with colleagues like Dr. Khosravi and Dr. Salazar on the essential factors in developing an efficient in-office aligner system using, obviously, 3D printing. So you can see this is a whole journal issue that was devoted to 3D printing. So in order for a clinician to be able to actually manufacture the aligners in office, or as we say, in-house, we have to have different factors. So first of all, you need to acquire the data. So as I will show you, you need to have a digital scanner, so we can scan the patient's mouth. We cannot take impressions. We cannot pour the stone models that we used to use back in my specialty. We need to use specialized software, and I have seen all the esteemed colleagues and speakers that are going to follow up are going to discuss more on that. So we need to have the scanner, the software. Then obviously we need to have the manufacturing process. So for sure, 3D printer, a thermoforming machine to make the actual aligner. We have to choose the aligner material, and then we have to trim the aligner and deliver it to the patient. So this is a non-professional video we took a couple of days ago with my assistants, one scanning the other. So that's the scanner that we have. So pretty much taking a lot of pictures per minute. It's very detailed, and you can see live on the screen. That's kind of fun for the kids to watch their teeth appearing on the screen. So we acquired the scan. That's the lower, and obviously we're going to have the upper arch, but for due to time restrictions, I'm not going to show the whole process. So we take upper and lower, and then we upload it to the software. I have to digitally move teeth because that's the whole science, right? You have to still be applying the orthodontic principles to move teeth. And then we go to the manufacturing part. So we acquired our first 3D printer about, I would say, 7 years ago. And there are different kinds of printers. So there's one that can be optimized for dentistry. So it's a good for a person who is not very familiar with that technology. It's kind of a plug and play. And you have also the post-processing, the wash and cure stations that are, part of the whole package. So we started with such a printer, and now we're using non-dental 3D printer, which is more cost effective, but it does need a little bit of calibration and obviously more experience using it. But you can use any printer pretty much. You don't need a specialized printer. Speed is an issue, and as with other technological innovations, I'm very, very happy to see that new printers coming out. Speed is much better than our initial one that we maybe had to print the actual cast during the night. Troubleshooting might be an issue if you're not using a specialized printer, but also in Greece, but not only in Greece. We also have to consider the cost of consumables, of disposables. As I said, we are planning on using all that new technology for patients to be able to afford it. Now, learning curve, if you're technologically savvy, it's not that acute, but we have to invest time and money whenever we're doing something good, but that's the thrill, right? We don't want to be stagnant. Have good after sales support. And obviously, as I said, I'm mentioning social media because I'm very, very grateful to people around the world that are sharing information on 3D printing, like how we're doing right now. So the final result of the 3D printer is this. We call that the orthodontic model. So it's a resin printed model. We use an SLA printer to print it. So our largest printer so far has a big platform. We can pretty much print about 50 to 55 models in about 3 hours, which is pretty good because initially we were able to print like 6 in 8 hours. So very, very happy about that. After we print them, we need to use different materials. We call them thermoforming plastic sheets. It's the actual aligner that obviously has to have desired traits, which is not part of the talk right now. And this is our, very proud to say, our last tool that we're using. It was the first office in Greece that we got the actual robotic arm to trim it. So what it does is kind of unloads all my staff that they have been working in the lab, trimming all those aligners. And now we can use the robotic arm to kind of streamline the process, make it easier. It doesn't only have to do with return on investment. I'm not sure, when I'm going to have that pretty much evened out, but it was a very nice addition to the workflow. So it can be more streamlined, it can be more automatic. And we were actually playing with that during the pandemic because we had more time. So very, 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 very smooth. And you just have the final material in the final aligner in less than a minute. So pretty cool. What we're looking for, and I was at the last orthodontic meeting talking and listening to, the next, kid on the block, which is the directly printed aligners. So we won't have to print the cast. We're going to print the actual aligner, which will be, obviously, will have less waste production, and ecology is a big issue, right? We are trying to recycle a lot of things, but it would be nice if we can skip a step and be more, ecologically friendly. Obviously, the material has to be biocompatible. Cost is right now not affordable for a practice. It's good just, to experiment. Post-printing processing is quite intricate right now. Properties are not so far ideal, so we're looking forward to the next step. Before sharing a clinical case with you, because I'm a clinician, I just wanted to say that we can incorporate technology, but the science should be there, right? So technology doesn't solve our problems. You have to obviously do good treatment planning and good diagnosing. Have to know your biomechanics for aligner treatment, which is different compared to braces to fix appliances. Our patients have to be compliant. The clinician can decide which components of the workflow wants to incorporate in the practice. So you can have a 3D printer and not make your aligners afterwards. You can delegate to an outside lab. We need to involve our staff, obviously, and be patient with a learning curve as long as we like what we do. On the other hand, we do have full control of the process. So I do the design and the manufacturing in my office. I don't have to, send to a company. We can be competitive. It's very speedy. So I can pretty much print and give the aligners to the patient even the same day. We can customize a number of aligners and maybe scale from mild to moderate and to complicated cases to build up our confidence in the method after following, all those footsteps that I'm saying. So it's the health issue, the design issue, and obviously the manufacturing issue. So jumping to the case, so my speakers, the other speakers, co-speakers can follow up. So this is a patient of a single mom. I live in a comparatively small city, so we're almost all, we know each other. So she came to me and she's like, he cannot bite. He has a functional issue. He has a deep bite. So he traumatizes his gums here. And he was retrognathic, and I want to do the best for him, but I couldn't afford it. So I told him, you know what, we'll try to do my best, give an optimal result, and try to squeeze, the cost, and let's see how it goes. So the patient was super compliant. And what I saw is not 3D printer. That's a conventional appliance. So I'm doing a hybrid kind of approach. So I'm using something that was used even decades ago, a functional appliance to get the mandible forward, just for 12 months. So I have a happy patient. And after I'm done with the most complicated part, which is improving his skeletal problem, I'm kind of stuck with the dental issue. So a couple of years ago, I would have to put braces, which is more expensive, or ask for aligners from an outsourced lab, which is also expensive. So I said, no, we're going to print out our aligners after taking my records. And this is the malocclusion just before we started. So this is the software, and this is obviously a very, very easy case. So it's just 7 sets of aligners switching in 10 days. And this is the software that allows me to move teeth in stages. And pretty much in less than a year, he's done. And I was surprised because he was done with just 2 removable appliances, conventional ones, and 7 sets of aligners, which is very cost effective. And I was able to offer a great difficult treatment to a patient that the mother was struggling to offer the best for him. So that was a happy moment for both me and my patient. And always nice to see how kids grow and have a better smile and more confidence with orthodontic treatment. And obviously, a lot more difficult cases can be treated in office if the doctor feels comfortable doing it. So my take-home message for not only for orthodontists but for anyone who's into innovation is take a step-by-step approach and give yourself time to learn. And again, be grateful for what's out there for free to share. And this is a very, very interesting journey for me. Actually, I don't get bored because I keep learning. Before thanking you for your kind attention and opening the QA session, I wanted to share, this is from Philip II, Alexander the Great's father, from his tomb, which is very close to my hometown. And this is a masterpiece, right? This is a handmade artifact. So this is not obviously 3D printed, but I had it as my final slide because what I want to say is technology, and artificial intelligence is here to stay. But it's a nice thing if we can combine it with human resources and also being very ethical about treating our patients if we're physicians. So that's concluding my presentation, and we'll stop sharing so we can start the Q&A.
Okay, we have one person who entered 5 questions, but let's I mean, they're good questions, and Ahmad, I think he's like a founder of a startup, so that's awesome. But let me just start with a couple of things that you mentioned. Just one question from me is, we have Smile Direct Club, we have Align Technology, we have now Impress, which will speak soon from Dr. Kassem, and then and then a bunch of people like you, orthodontists who want to do it at chairside. How do you compare the quality? Obviously there is a trade-off of price as well, a significant increase in price, especially with Align Technology. So like, how do you discuss these options with your patients?
With patients, right. So I would say there's a cutoff point of malocclusion, which means that if something is very, very complicated and I need to print, let's say, 70 pairs of aligners, that's it. That is not really cost effective to print in-house, to print in office. So I would rather do it outsourcing it. The patient knows, or I might even propose that they can use braces instead of aligners if that's too expensive. But if it's something very complicated, or if the patient is abroad, which means that I have to provide the whole treatment, let's say for a year, and maybe have to monitor, it's more predictable to use a more advanced software, like, as you said, Align or different other companies. But if it's a more moderate case, and if I can monitor the patient more often, so if I can see the patient, let's say every 2 to 3 months, so I can pretty much evaluate and again, scan again, and then provide more aligners. Because if I print all the aligners and the patient is not as cooperative as I expected, then we just have to throw all the aligners. With big manufacturers, you tell them, there's a down payment because I'll have to pay for that invoice. So they might be more committed into a more complicated case. So to me, from a practical standpoint, I take a look at the complexity of the case. If it's too complicated, it's not that I cannot do it in office, but it's about the same cost-wise. Mm-hmm. So I might ask the patient that, yeah, you can use a bigger manufacturer, or give them the choice if they want to come more often and scan them and print in stages.
Awesome, thank you. I just remember that when I started my 3D printing journey 6-7 years ago, actually one of my good friends is actually orthodontist, and one of her dreams is actually replace Align Technology, her ambition. Wow. And it didn't happen with her practice, but finally I'm seeing someone is doing it. I'm pretty sure more people are doing it based on today's webinar. So let's go to Ahmad's question. He is asking, what are the rate of models or cases per month for your practice? Do you have a
Right, meaning, I guess, the number, right?
Yeah.
Number of models. So I guess it depends, right? And as I said, Greece is a kind of a different ball game. So now we're having elections, so people are kind of scared every time we have. I would say we might be able to print around 30 to 40 aligners per day, or even more. So I might have quite a few, let's say, patients that might come with relapse, which is fewer aligners. But if I have a full case, I might have to print for just one patient 30 pairs of aligners in one day. So I'm not really.
I think in the he probably wanted a range. I mean, there's no set. So I think you kind of answer the next question is, do you print the whole case or you just print, whenever the patient needs it?
Yeah, I won't print for every month. I would mostly print up to 3 months because it's not also very practical for the practice to have the patient and for the patient to come every month to scan and print and scan and print, because it's not only scan, it's also the design behind it. You have to move the teeth. But even if I have the whole case, let's say I have a case now for 9 months, but I have designed it for the whole 9 months, but I'm printing the first 3. Checking if the patient is compliant, and then I don't have to design it again. I'll print the next 3 months, and we go on from that on. And that's based on my experience. It's not something scientific, right? It's practical.
Yeah, the patient compliance part is apparently very challenging, according to my friends.
It is, and you cannot predict right away. Hopefully, they know that it's in their favor, obviously. And most of the patients are very compliant because it's also very aesthetic. So it doesn't bother them. They can wear it almost full time.
Yeah, right. Okay, another question. Are the design services companies, I'm not sure exactly this is what he meant, but it says, would this allow, general practitioners to make aligners in-house as well, just like you do?
Well, that's up to them. If they feel they're competent, it's not, the problem is not printing. I mean, you can learn how to print, right? Or you cannot. That doesn't have to be a dentist or an orthodontist. It has to do with if you like the technology and if you understand it. The problem is the treatment planning. And that's why there is a 3-year specialty program to be an orthodontist. So to tell you the truth, I don't feel comfortable if I was to be treated by a non-specialist, but they're entitled by law to do it. So if somebody feels that they are up to it and that they can finish the case nicely, functionally and aesthetically, yes, obviously they can use the whole process and do an in-office aligner system for sure.
Right, and especially if you're in a small town, like you said, right? There's nobody else doing it, so they have to find some kind of dental practitioners. And dentists, and actually, Align Technology's tool is getting easier to use. I think general practitioners can use it. I think that's their goal, at least.
Oh yes, because we are as clinicians, once you scan, you are actually feeding them data. So you are helping the algorithm get better, which was kind of scary. So that's what I said. I'm using my knowledge now, and I'm treating my own patients in office. But that's a trend that is not going to change, big manufacturers, because obviously it's an industry, right? I'm just saying there is another option, and
we have quite a few other options here on this panel, especially Ian has a AI enabled digital process that I think people would be interested in look at. But we have a few more questions on this list. Yona, if you want to type in your answer, please feel free, but I have to move on. Thank you so much for this excellent presentation. Gino, you want to come on stage? And then we'll go to Dr. Mandanka. So Gino is actually the lead for dental 3D printing at HP, who is our sponsor. He wants to have a few minutes just to share his work there.
Thank you very much, Jenny. Can you hear me well?
Yeah.
Okay, perfect. So I'll keep it very short. So good morning and good afternoon to everybody. Thank you very much for connecting, and thank you again, Jenny, for organizing this great event. And it's really a great pleasure to sit down with such a fantastic panel. I mean, I've been over 5 years in additive now and 2 years in more focus on orthodontics, and I feel very small being surrounded with such experts in this call today. So yeah, really interesting presentation from Dr. Johanna as well. Looking forward to the rest of the presentations. Maybe a quick introduction from my side, and I'll point out very shortly what we do as work in our end. So my name is Gino Balistrieri. I joined HP 5 years ago, actually initially as a global product manager, focused on high volume production. How can we scale additive further, and what are the barriers across different verticals? And as you know very well, I think most in the call here, that high volume production and dental go very well hand in hand. I mean, it just makes a lot of sense from many different aspects, including the personalization side. So I had a great mentor with over 25 years of experience and retired now, that helped me ramp up on the orthodontics. And I'm also pointing it out because I believe he's connected to the call as well. So if you're there, Lee, good morning to you. So since then, I've been working closely with aligner customers across the globe, and at HP in the field of orthodontics, we are very focused on high volume production for the aligner models, and we are unique in the way that we have a scalable solution that is powder based. And that actually, if I need to point out just one specific element of the work we are doing, that gives us the unique ability to actually fully recycle the waste streams from aligner production. And of course, if you go to scale, that becomes a serious issue. So if I just share my screen very quickly, hoping you can see my screen here. So we've really focused on that end, because we see it as a big problem. If you start printing, of course, if you print 10, 20, 50 models, it's not really a big issue. But when you go to hundreds, thousands, 10,000, or even millions of parts per year, this becomes a massive waste stream, both in resin or powder, and of course in the models itself, right? Because you use them only once and then you throw them away. So we're putting a lot of focus there on that end and how we can recycle that. So we have different programs with different customers where we are basically recycling all the waste streams. We have even partners that actually buy it back from you. So it's because at the end it's value, right? So what they're doing is basically buying back all the models, buying back the powder, actually pelletize them, grind them, pelletize them for injection molding, and then use them in another manufacturing process, right? So kind of working on this closed loop system. We see it very, very important in other industries, actually. So in my past experience in cosmetics, for example, if you don't have anything in sustainability, you can't even enter the room. And dental seems to have been a bit slower in medical in general, but we see it coming as well. And of course, aligner customers at the end users are generally very young, 20s, 30s, teenagers that care more and more about sustainability, right? So for us, it's HP. It's a corporate strategy. It's very important, but also personally, to be honest, it's a very important reason why I'm here. Just one more slide to show like one example, right? So we actually partnered with different companies: Smile Direct, Ford, Laverne, which is a tier 1 from Ford. Actually, in 21, already started using recycled dental molds into fuel line clips. So for the F250, so the F250s that are out there, they generally have these fuel line clips that are actually used from powders and models that were used for aligner manufacturing. So that's a little bit the work that we're doing. So I would say I'm not an expert in the front end. I know a thing or two about the aligner manufacturing side, right, at scale, but I'll leave the clinical aspect to different people that joined here, including Dr. Khaled Kassem, of course, who is one of our customers as well. So looking forward to the rest of the presentations.
Thank you, Gino, especially for the sustainability talk, because we don't want these to end up in the bottom of the ocean all the time. I always wonder about that question. So I'm glad that you guys are doing it. And so our next speaker is Professor Madanka at Virginia Commonwealth University. He teaches general practice. So his goal looks like Gustavo wants to enable general practitioners to do 3D printing